Good morning, and welcome to our continuing series, Interviews with Disciples and Devotees. Today, again, we are very pleased to have with us Dr. Pachegaonkar to speak on mind and body relationship in homeopathy. Welcome, sir. It's a big subject.
Yes.
Is it not?
Yes.
Where does one begin?
See, everyone knows that body works under the governance of mind. So it is the mind which decides first, be it even painting. Like that painting starts in the mind of the artist and then the hands draw it. So certainly whatever activities we have are governed by the mind. Naturally, the central entity to even health preservation, it is mind which governs. So there are many disorders which start in the mind first and then it percolates onto the body. Or it is actually deviation at the mental level which results into somatization at body level. So in homeopathy, we treat the whole person as one unit. At body level, vital level, as well as at mind level, we study the whole individual and try to study the individual as a whole and then match with the remedy. And the remedy which is matching at every level, like body level, vital level, as well as mind level, it is supposed to be the best simillimum. So we don't treat the person on the specification of disease, but we treat the person who has that specified disease.
Well, let's take an example of herpes.
Yes, herpes simplex or herpes zoster, whatever it is mainly sort of a viral infection. This is the common understanding that it is a viral infection. But see, like every individual does not come down with that. It is mainly the predisposition of the individual which gives, one background to thrive for such virus.
Really?
So it is mainly the susceptibility of that person to develop herpes which is the main reason and not the virus, because this virus has been there in the universe. But it becomes live and active only when the conditions are conducive for it.
But if the person is not conscious in the mind,
yes, of course, you may not be aware of like this virus or all. It is not like what organism is there, but it is the general immunity of the person which can't cope up with the situation, and therefore it allows these viral infection to thrive.
sometimes, rarely, very rarely, maybe once every few years, I get a cold sore. I'm told that's herpes.
Yes, but most of the times it is the body which it is a system, and in system what happens, body tries to react and corner it to the safer location. So these herpetic eruptions arising around the mouth, especially the corners or any mucocutaneous junction. It can be near the nose, it can be near the eye, any mucocutaneous junction.
On the lip a little bit.
Yes. So these are what we call that body is trying to push it to the periphery. So it can be like a curative phase also. Body reacts to it. It indicates your defense mechanism getting roused and the things are being cornered or put into safer location in the periphery. So we should not take eruptions negatively. It is body's defense which has confined this disease phenomena on the periphery to the safer location, and then it is resolved. It is resolved
by the body itself.
By the system itself.
By the
I won't
system
call
is-
body, but it is
Okay,
mainly the central
system.
system.
Okay.
Through body, of course.
Through
in the body.
Yes. Oh, I see.
See, there are like in homeopathy, most popular remedy all over the world is arnica for injury. Now, any injury, the first remedy comes to our mind is Arnica montana. This is a plant in a potentized form. But if you study the background that why it is specific to the injury, see the arnica person, like what we have done is Arnica montana we have given in healthy human beings, and we have observed the effects of this remedy in healthy human beings at different level. So the mental symptoms are very prominent in arnica. The arnica person is having a very strong ego, but with this ego is a stupidity, means he doesn't understand the limits of ego, and that egotism is so strong that the person stupidly exposes himself to the trauma or injury at every level. Means because of his ego he doesn't behave properly with the people, and when person doesn't behave properly with the person, then naturally he will get shock of his life, people will give rebuttal, and then he gets injured. So even when you are walking with egotism, not conscious of your movements, you are too rigid, then only there are chances that you get injured. And
So-
what we call a blunt injury. And arnica is supposed to be the best remedy even at physical level. But mainly such injuries even at mental level, because of the own egotism and not be having any plasticity or elasticity or adaptability, there most of the chances are that you are injured emotionally elsewhere also.
But you said you gave arnica to healthy people.
For proving, all homeopathic remedies are proved on healthy human beings,
I see.
because then you get what we call pure effects. Like exactly what are the properties of the remedy? Of course, these remedies are verified in the clinic. That sometimes, like accidentally, some poisons are taken. See, person is otherwise healthy.
Mhm.
So even snake poison, lachesis, it is proved in this way only. That they observed that the deadly poison of this lachesis, when it was collected and person in a very minutest dose comes in contact with this poison, he developed few symptoms. And those symptoms, these properties of the lachesis were utilized as a curative property in homeopathy. So there are accidental provings, there are intentional provings. So invariably, this is the cardinal principle of homeopathy, that all the properties of the drug should be known in a purest form. So basically all homeopathic remedies are proved on healthy human beings to understand the clear-cut symptoms of that remedy. And therefore even more than 200 years now. And homeopathy, the properties of the remedies are never what we call outdated. What properties were observed by our founder Hahnemann and his team are still getting verified in the field, that they are there. There is nothing like an outdated drug or something. Same properties carry, because all these properties which we have recorded in Materia Medica. The name of our Materia Medica book itself is Materia Medica Pura. By Hahnemann. He has 2 volumes, and in his lifetime, like when he started working on homeopathy, he worked almost like 50 years. And in 50 years, he and his team, they have proved almost 99 drugs at every level of the being. And each drug, the utmost importance is given to mental symptoms. Generally in practice, what we do is, we try to work out the whole totality of symptoms. Totality of symptoms, like what we call right from birth, we collect all the details, And when we come across some range of remedies which is fitting into all the complaints, then we differentiate these among these remedies on the basis of mental symptoms.
Oh, to speak to our audience again of my this personal little thing, this herpes. I'll tell you how I have treated it in the past, and you tell me how it's done in homeopathy. I can put a little Blistex on there, a little Abreva, and in 2 days it's gone. Now, if I didn't put anything on there, it could last for weeks.
Yeah. No.
So how do you treat it?
Yeah, that is what. No, we treat it as one of the component of totality. Same example, like we have many drugs, wide range of drugs which cover this herpes simplex. Or herpes labialis, we call it, if it is around the lip.
Okay.
See,
what is herpes zoster? You mentioned that.
Pardon?
Herpes zoster?
Herpes zoster is affecting the nerves. So therefore it is very painful as compared to this herpes simplex. This we call in general herpes simplex or herpes labialis because it is around lips. Herpes zoster affects the nerve endings and therefore it is very painful. It is a mutated virus of chicken pox like thing. So this virus is dormant in the system. It remains dormant, and when the immunity of the person is down, it surfaces in the form of herpes zoster. And not only
where does it occur in the body?
It's all over.
Oh.
Anywhere, nerve endings, peripheral nerves, they get affected. So it can be on the trunk muscles, it can be on face, it can be on limbs, anywhere it is possible.
Reproductive organs?
Pardon?
Reproductive organs?
It is mainly the nerves which get affected, the what we call peripheral nerves. So the internal organs, they are not
affected.
Yes, they are not affected. It is mainly the peripheral around the skin.
Yes, so you're cured.
So, like for example, we have one very common drug called Natrum muriaticum for such herpes. There are several drugs. That one is Natramur, but we don't give Natramur on the basis of local symptom. We always will look for like how is the mental disposition of the person. For example, some Natramur patients, they are mainly very introvert type. They would never show their emotions outside. They never share their emotions with anyone. They are prone for depression. They go on brooding, especially when they are alone. They go on brooding over negative things. Not only that, they seek solitude to brood over negative things. Even if they cry, they would just go shut themselves in the room and cry without anyone knowing about it. So on the basis of these peculiarities at mind level, emotional level, we select a remedy which fits into, even covers the corporeal symptoms like herpes simplex or something. So we don't treat the herpes simplex, but we treat the person who has developed herpes simplex. And then in turn it gets all right. This is the principle.
In turn, as I said, in 2 days mine clears up.
Yes, but
just a couple of treatments.
Yes.
But how long does it take with homeopathy?
Then again and again you may get it.
Very rarely.
So that the disposition goes off. And another thing I'll tell you. Like I'll give simpler example of wart.
Okay.
So suppose someone develops a corn in the foot or wart.
Or what about breaking out in the face?
Yes, that also. So so these warts, if we start treating homeopathically, we don't treat the wart per se. We take the whole totality of the person who has warts. And in that totality, of course, the occurrence of wart is one of the component. So there what happens, we are treating the person at deeper level. Because mind is given the utmost importance in our totality. and we try to select a remedy which definitely covers his mind and then the warts together. And in such cases, what happens, when your central system is corrected, then the knowledge of wart being maintained at the central system, at that level the deviation gets cured. And then not only this wart disappears, but even the future warts will not be there. So the same way like herpes simplex.
So in the future it won't be there.
It won't be there. That is what we have observed in keloid also.
Okay, then if the person is still very indrawn and wants solitude and never expresses himself, as you've said, why should it not come back after you treated it once?
Because it actually resolves the issues at a deeper level, at the very level of mind. The issues are resolved. So person, takes things so easily and resolves it. See what transpired in childhood. We have a case where she had a mother who had rheumatoid arthritis, and so she was a bit irritable. Then her father was very dominating, so he used to dominate everyone. So mother used to suffer because of husband's domination, and she used to be very strict and with the children. And now this so-called child, that lady is now above 60 years. Mother passed away before 15 years. But still she is carrying those impressions and suffering from that. Like, just imagine for a normal person what transpired in childhood, how mother, behaved with her, doesn't carry any significance now. She is independent, she is 60, mother passed away in 50, but still she is dwelling upon it. This is something abnormal. So one remedy will definitely resolve the issues at deeper level, at mental level, and now she will just forget that negative past. She may just learn the lessons from the past, but will not go on brooding upon the past events. So once you treat that tendency, then why should it come back? Even with a fresh provocation also, the person will be able to resolve it at deeper level. So definitely it works, and that's what we say, the cure should be like gentle and permanent. There is no point, like you said, you applied something and it disappeared. But what about your tendency?
Yes,
See,
it's still there.
Like
it's still there.
Wart.
Of course.
Wart. You just resect it. Surgeon will say, what is there? It's harmless. You just resect it, remove. But then what? What about the tendency? You are not tackling at that level. Same thing is like renal calculi. If you just remove one calculus by surgery, what about the tendency? Tendency remains. So we have to treat the person at that level, and mental symptoms are given utmost importance.
You said 90%?
90%. 90% of the cases we have seen many times. I had one case, the person had very simple complaint, just local complaint. When he used to yawn, his temporomandibular joints used to get fixed and dislocated. And he was not able to shut his mouth. And we have not proved our remedies to the extent that they get this complaint. You see, the limitation of homeopathy is we are proving our remedies on healthy human beings. Now you can't prove a remedy till it gives maximum pathological symptoms. Ethically you can't. Only at functional level it's fine, so long as everything is reversible. So I couldn't locate any remedy where this sort of dislocation is there. And 2 weeks I studied this case, what we call a local malady. Barring this, he did not have any other complaint. and orthopedicians just trained him to manipulate and help himself to
on
release
a physical
it.
on a
Yes,
physical level.
Physical level.
Yeah.
He would just manipulate and tuck, he will make it set right. But again and again, he was getting it. Then I started working on it, and on the basis of mentals, I started collecting the data that how he behaves, like he is more concerned about others, he can't tolerate injustice on anyone around, he goes out of way to help the people around. Sometimes he landed up in soup because of his helping nature. And even like all the complaints were right side on him from very childhood. He had history of sciatic pain also. On the basis of history and his generalities, he craved more salty taste, all that. I just gave him a remedy called causticum. Causticum is a potassium salt. And when I started treating him with causticum, after 1 month he came and told me, "Doctor, I can't tell you whether I'm cured or not." I said, "What happened?" Means it is you who would tell me, inform. And then he said, "No, I did not yawn in last 1 month. So how should I know whether it is getting dislocated or not?" That means even I had not noticed that excessive yawning, because why should one yawn several times in a day? And excessive yawning also was one of the symptoms in causticum. But I prescribed causticum on the basis of mental symptoms and the cravings and generalities, whereas he stopped yawning, and then there was no chance of dislocation unless he yawns.
Yeah.
And then again I said, okay, this seems to be your remedy. So I gave still higher potency. Like earlier I had given him 30, then started 200, and then 1 I gave. And later on he came that, "Oh yes, I yawned, but this time it was not dislocated." Means actually the entry point for our treatment was his dislocation tendency. But for me the drug did not have that symptom. Whereas on the basis of mentals, when I prescribed, this thing got cured. So this is the best part in homeopathy.
So if we could just talk for a few minutes on the 10% where the body is involved and not the mind.
Yeah. See, it's difficult. Like sometimes, suppose some poisonous bite is there.
Yeah.
Definitely the mind has nothing to do with it, isn't it?
That's right.
There is physical corporeal trauma. Yeah. But there, see, like same injury, if 10 people are inflicted, their reaction will not be the same.
Oh, let's say a scorpion bite.
Scorpion bite. So same volume of a scorpion bite, each one will not get affected in the same way. So there is individuality. So in scorpion bite also, we ask like what type of pain it is, stinging pain, relieved by cold or relieved by warmth. On that basis we select, we have like cedron, we have ledum pal, these remedies. So there also we use the sensations and mental symptoms to select the remedy, even for scorpion bite. So definitely mind has a role in it, if it is available, and that is what we say, when mental symptoms are matching, we give the highest potency. With presumption that the person is very sensitive to this medicine because he has developed symptoms at mind level and that much peculiar. Therefore we give higher potency, and we don't need to repeat the remedy where the mental symptoms are clearly matching with the remedy. Just one single dose. Hypothetically, one single dose would suffice to cure even a serious disorder if it is matching at all the levels, and especially mind.
One last question. Last week, I believe I received from you about a lecture on spondylitis.
Yes.
Can you just say a little bit about the response to people and the talks?
Yes. People have responded positively. They are very happy that they have realized themselves that spondylitis again is the after effect of deviation at the mind level, the level of awareness. If the person is aware of the movements or the dynamics of physical movements, then the spondylitis starts receding. It reverses. Like simple, the people who had neck pain, they just started now raising themselves and keeping them alert and lifting up. Within minutes, the spondylitic, discomfort is relieved. So many people have gone through the video. They liked it. Yes,
very good.
Very
Thank you so much. Very informative. Namaste.